Hello, we are the Association for Child and Adolescent Mental Health, or ACAM for short.
So hi everyone, thank you so much to Matt and ACAM for such a kind welcome this afternoon. So just whilst we're waiting for Barry to join, I'm going to kick off with talking through our learning objectives. So the idea for the session today is going to be to look at the evidence on the relationship between sleep and well-being in children and young people, and to look at, in particular, the relationship with anxiety and depression, but also the impact that sleep problems have on life at school for students. Then we're going to wrap up the final part of the session by looking at some of the practical techniques and tips that can help young people to get a better night's sleep. So focusing really on those things that we can advise young people to try and talk to families about, things that they can be trying themselves at home. So before we start the talk, we're just going to kick off with a poll, really to get a sense of who we've got here in the audience with us today. So if we could just launch that now. Okay, great. So yeah, we've got a really nice range here with us from both primary and secondary, as well as special needs schools and other types of schools as well. So yeah, really great to have a mixed audience. So yeah, thank you all for being here with us. So yeah, my name's Faith Orchard. I'm going to be talking to you about improving young people's sleep. I'm currently working at the University of Sussex as a lecturer in psychology. And my background really came from mental health in young people, particularly depression in young people. But as part of that work, it became apparent to me really quite quickly that sleep problems were a massive problem amongst mental health difficulties. And this really took me on a journey through trying to understand more about young people's sleep, how it relates to mental health, but more importantly, how we can work with those sleep problems to support young people to improve their well-being, as well as their kind of education and other life experiences. So I'd like you to have a think about this question first, and if you could pop your ideas in chat, that would be great. So I'd like to know why you think sleep's important, and in particular, what you think the effect is of having a poor quality night's sleep, and what the effect is of having a good quality night's sleep. So really just perhaps from your own experiences of things that you've heard or been told, really just kind of your own ideas on this. Okay, great. So some really nice ideas coming in. And we've got ideas like affecting concentration, affecting emotions. What else have we got? Affecting memory, absolutely. Regulating emotions, yep, great. What else have we got? Feeling irritable, yeah, and kind of, yeah, stressed and angry when we're struggling to sleep. Brilliant. Yeah, so loads of really, really great suggestions. So thank you for sharing those ideas and do keep them coming. So these were the ideas that I wanted to share. And again, these are really just a snapshot of some of the effects that can exist. And we've seen a lot of these coming up in the chat. So when we get a bad night's sleep, we might have mood swings or feel really irritable. We can feel like we're lacking in energy. And yet we can struggle with concentration, which is obviously very important as part of our learning. And one that didn't come up actually is the fact that we are much more accident prone because our responses are a bit slower. So on the flip side of that, if we have a good night's sleep, we feel better, we're better at regulating our emotions. So even if things are difficult for us in the day, we can handle that much better. We have more energy. And a really interesting one, actually, thinking particularly about school and education, is the fact that memory is affected by our sleep. So if we get a good night's sleep, we have a better memory for what we've learnt during the day. So actually, this is a really important one for thinking about the role of schools and teachers. And again, we see that effect with more physical reactions as well. So it affects our immune system. Okay, so I'd like to move on to thinking about what actually happens, how we sleep. So a bit of the biology. I'm not going to spend too long on this, but some of these processes are really important for us when we come to thinking about how to get a good night's sleep. So there's two processes involved in sleeping. The first one is what we call sleep homeostasis. And this is the pressure that builds up throughout the day, so that when we get to bedtime or to nighttime, we've got a really kind of high build up of sleep pressure, and our drive to sleep is really high. So on the figure on the slide, this is the blue line, so the one that's increasing throughout the day until we go to sleep. The second process then is a term you might have heard of called the circadian rhythm, and this is our body clock. So this runs on about a 24-hour cycle, and it releases hormones at the right points of the day to help us to fall asleep and to wake up. And that's the red line there on the graph. So in an ideal world, these processes work really nicely together, so that as the pressure is building up throughout the day, towards the evening, the body clock knows to release melatonin and the hormones to help us trigger sleep. Then what happens is once we go to sleep, those hormones drop off and the pressure dissipates. So it fades away during the night, and then the whole process starts again. So this graph is what you would like to see in an ideal world if someone's getting a good night's sleep. What also happens whilst we're sleeping is that we go through different stages of sleep, and you might have heard some of these terms before. So we talk about Rem sleep, which is rapid eye movement sleep, and named on the basis that the eyelids are moving very quickly, the eyes are darting when we're in Rem sleep. And what's really interesting about this stage of sleep is that the brain's very active. So if you look at the figure on the slide, this is a recording of brain activity, and the REM sleep, which is the bottom line, you'll see is quite similar to the top line, the awake stage. So we're in a very active stage during REM. Our breathing is quite fast, and we're most likely to be dreaming during this stage. Then all the rest of the stages are all clustered into non-REM. And they vary from the lightest sleep, where we might feel quite awake, all the way down to the deepest stage of sleep. And all of these different stages can be differentiated by the brain activity, so that, the EEG recordings that you can see here, but also by things like our heart rate, our breathing, our body temperature, our eyelid movement. And these are all the combination of all of these different factors can help us to tell what stage of sleep someone's in. What's quite interesting is if you look over the course of the night, and this is a hypnogram, this measures sleep stages over the course of the night, we spend different amounts of time in the different stages depending on where in our night's sleep we are. So we start off spending a lot more time in those deeper stages of sleep where we're doing that kind of really critical kind of recovery and repairing of the body. Then as we move into those lighter stages and more of the REM stages happening in those early hours of the morning, we're doing a lot more of that cognitive work. So lots of that kind of learning and processing and kind of working through our emotions. It's also really normal during the night to have brief awakenings. That's a perfectly healthy response during sleep. We might know they're happening, or we might not even notice. We might wake up so briefly that we don't realise it's happened. But that's really normal. And again, this would be kind of what you'd like to see in an ideal night's sleep. Okay, so I'd like to just move on to thinking a little bit about how sleep develops over the course of childhood. And we do see some quite significant changes at various time points. So if we start with the first couple of years of life, we have a really interesting start to life in terms of our sleep, because initially we don't have a body clock, we don't produce our own melatonin. So infants typically are going to be getting their melatonin through breast milk, and that will help to trigger the sleeping stages. But quite quickly that body clock starts to develop, and infants start to regulate their own sleep. And the biggest changes we really see during those first couple of years of life are in the reduction of sleep. So it's going to be a lot of hours slept in the first 6 months, although it probably doesn't feel like it for parents who are in those stages. But that's going to be gradually reducing once you hit 1 year and then into the preschool years. Finally, during those first few years of life, the problems that we're most likely to be coming across might be around things like safety during the night, and also starting to create sleep routines. So most of the support families might need tend to be in those areas. Once we transition into the preschool ages and into the school ages of childhood, so kind of primary school, again, we see this continued reduction in the amount of sleep that's needed. But at these ages, we start seeing a wider range of sleep problems emerging, and potential for sleep disorders to start occurring at these ages as well. So there's a very wide range of sleep problems that might be experienced, but this could include things like insomnia, night terrors, or we might see some very physical sleep disturbances like head banging or teeth grinding. I'm going to spend a little bit of time in particular thinking about teenage sleep because there's some really significant changes that happen to sleep during this period. So the first thing to note is that, again, we continue to see this reduction in how much sleep is needed. And these quantities of sleep that I've been referring to so far are taken from sleep guidelines. And these give us a recommendation for what sleep quantity you might be expecting at that age. So for teenagers, the recommendation is 8 to 10 hours sleep a night. So I'd like you to have a go at another poll for me. And this time I'd like you to tell me what proportion of teenagers, what percentage of teenagers do you think achieve that recommended amount of sleep, that 8 to 10 hours sleep a night? Brilliant. Okay, so results are in. So yeah, we've got a mix, but majority of people tending to think that there's less young people who are getting those 8 to 10 hours sleep. So brilliant, thank you. So it's actually very variable, and a really good nod actually to those large proportion of you that voted for the first option. So for quite a number of years, 30% was the number that we believed we were sitting at. We are being a little bit more cautious now than those initial numbers, but more because actually just the data is really variable. So there is evidence that suggests that as few as a third of young people are getting the recommended amount of sleep, particularly on school nights, and we're going to revisit that in a moment. But we know that there can be a lot more teenagers that are getting the correct amount of sleep, and particularly on the weekends, young people are more likely to achieve that recommended amount. So it seems to be that it's those school nights in particular where we are seeing issues with not enough sleep being achieved for teenagers. I do just want to add a bit of a nod here that the guidelines are always a little controversial because they have to draw on the evidence and the literature that we have, and there's always challenges with measuring sleep, and there's masses of individual differences. So some people need less sleep than others, and some people need more. So although 8 to 10 is the recommended, it doesn't mean it's necessarily optimum for everyone. Some people will be perfectly well and happy with more or less than that. And also within those individual differences, you've probably heard of the idea that we get the night owls and the morning larks. So people who have patterns where they go to bed quite late or they go to bed quite early. And again, they're kind of natural preferences that our body has. And again, that's absolutely fine. And we're going to move on shortly to thinking about mental health. And the most important thing I want to highlight here about quantity of sleep is it really just comes down to whether or not we can function. So if we're getting 9 hours sleep but we're really struggling and that's not enough for our body and we can't kind of think or learn, then we probably need more than 9 hours sleep, and that's okay. That's what our body is telling us we need, so we need to adapt to that. Equally, if we're getting 7 hours sleep and we feel fine and we're functioning well and we're doing all of our hobbies and we're learning, again, that's okay. So what we're really looking for is that point at which we see that day-to-day impact on functioning. So I want to just speak shortly about why teenage sleep is so problematic. Why do we see these really low proportions of young people getting the right amount of sleep? And this problem was really nicely coined the perfect storm by Mary Carpenter, who is an American sleep expert. And Mary Carpenter identified these key areas that influence teenage sleep. So the biology, particularly puberty and development, the psychology, so our developing our independence, developing relationships, and then the society that surrounds us. And there's a couple of key kind of interactions that go on here that make teenage sleep really challenging. So first of all, in terms of our biology, there's a really interesting change that happens if you remember back to those two sleep processes that I mentioned at the start. So the circadian rhythm, the biological clock, shifts later when we're teenagers. So our body doesn't release our sleep hormones until later at night. And similarly, it takes longer for our pressure to build up. So everything about our biology is actually wiring us to not go to sleep until later when we're teenagers. Now, this isn't just a natural change with age, because once we become adults, these shifts go back to what they were before. So we can go to bed earlier and go to sleep earlier. So this is very unique to teenagers, that there's this natural biological change. And it happens to all animals. So this is not a societal factor that's affecting our teenagers. This is a biological rhythm that means we're just not ready for sleep until later in the evening. Now, the challenge really comes in here when we deal with that conflict between kind of our biology that wants us to go to bed later, but society that needs us to continue doing things the same as we did before. And this is where we see this impact on school nights in particular being a challenge, because young people from kind of primary to secondary continue to get up at very similar times for school, even though biologically, as we become teenagers, our body clocks probably would want us to go to school later. So we have this challenge where what happens is our window for sleep becomes quite narrow on school days, because we naturally can't fall asleep until later, but we're still getting up quite early. So we see a sleep deficit, particularly on school nights, more so than we do on weekends when teenagers can follow their body's natural rhythms more closely. Okay, so I'd like to think a little bit more about actual sleep difficulties with you. And I mentioned some of these earlier when we spoke about childhood sleep. So the most common sleep problems we see in young people are normally around difficulties getting to sleep and staying asleep. We sometimes see problems sleeping too much, although particularly in teenagers that is a bit less common because of those problems that I've just described. And then there are a range of other things that we might see as well. So we can see some very significant shifts to sleep habits where the circadian rhythm is really quite delayed. And young people with something like delayed sleep phase disorder might be experiencing such significant sleep problems that they're struggling to attend school. So for the young people that you're working with in the school context, you're probably more likely to be coming across difficulties with problems like insomnia. So difficulties getting sleep, and then as a consequence, not getting enough sleep as well. And there are many recognised sleep disorders that we won't have time to cover today, including those parasomnias of things like nightmares and night terrors. But if you've got any questions, do share them with us, and we will try and get around them at the end. So then moving on really to the kind of the second part of the talk today is thinking about the relationship between sleep and mental health. So we know sleep problems commonly occur alongside many emotional and behavioural difficulties, and perhaps the ones that we commonly think of might be anxiety and depression, but then other areas like ADHD or perhaps autism as well. But we actually see sleep problems occurring alongside many different difficulties, emotional or behavioural, so they're certainly not specific to those problems in particular. But I wanted to just highlight that around mental health, we see sleep problems being extremely common. So depression as an example, sleep disturbances are or have been found to be the most common symptom of depression among teenagers, more common even than low mood. So we see really very common difficulties with sleep amongst mental health problems. And I'd like to just talk to you about a little bit of research, and bear with me, I promise there's not too much, but this I think really is a very important piece of work that we were very thrilled to publish actually with one of the ACAM journals. So this was published in the Journal of Child Psychology and Psychiatry. And this piece of work really looked at the risk that sleep might play in future mental health. So we looked at a data set that you may have heard of called the Children of the 90s. So this is what we call a cohort study, where pregnant women were recruited and their children and their children's children have been followed up across the subsequent years since the 1990s, which gives us this really fantastic, rich data set to look at how various factors of development might be important for children and families. So we use this data set to look at the relationship between sleep and mental health, and we were particularly focused on teenagers because of those challenges with teenage sleep that we've just discussed. So at age 15, a subset of the study children, so 5,000 young people, took part in a diagnostic interview of their mental health, and they also completed measures about their sleep. And we broke these down into sleep patterns, which is the timings of your sleep, and sleep quality, so how disrupted your sleep is. And what was really fantastic about this data set was that we were able to look at future mental health. So across ages 17, 21 and 24, we were able to look at whether or not sleep at 15 predicted mental health, particularly anxiety and depression at those later ages. And we found that it did. So we saw relationships for both sleep patterns and sleep quality. And in particular, for sleep patterns, what we saw was the amount of sleep that teenagers were getting on school nights, so not on weekends, just on school nights, predicted anxiety and depression at all of those later ages. So what that means is the less sleep you're getting as a teenager on school nights, the more at risk you are of developing mental health problems, either later as a teenager or into your early adulthood years. And similarly, there were a few sleep quality factors that were related as well, in particular being very tired during the day, waking up more during the night, and actually also feeling like you're not getting enough sleep, that perception of your sleep quality. Again, these were all predictors of future mental health. And I think what's really highlighted by this study in particular is how important it is that we work with young people to improve their sleep and support them to get better sleep during childhood and adolescent years to really protect their future mental health. Similarly, just another quick piece of evidence that I wanted to show to you here. Again, this is backing up that relationship between sleep and mental health, focusing on depression in particular here. So this is a study, this is a meta-analysis. So this means that we looked at all of the studies that had examined sleep therapy and the effect on depression. And these were trials, treatment trials looking at the effects of sleep therapy. And what we really wanted to know was how big was the effect of having a sleep intervention on your mental health, in particular your depression. And we found some really large effects across the study. So if you'd had a sleep intervention, you were likely to see big improvements for your depression. Now, one of the problems for people like myself who work in this research space was that very few studies had done this in young people. So this was mostly working with adults. And most of the studies that had been done, there were only 4. None of these included individuals with clinical levels of depression. So these were all community samples with much lower levels of depression, where we're really going to struggle to see how much of an effect sleep interventions have. So really, again, what I wanted to just highlight here was the strength of that relationship. So not only do we see sleep predicting mental health, but also if we treat sleep, we see benefits for mental health as well. So there's really good, strong evidence emerging. And these are just a couple of examples of studies that suggests that we really need to support young people's sleep better. Okay, so for the final section of the presentation today, I'd like to move on to talking about some sleep techniques, so practical things that we can do. These apply to all of us, but I suppose particularly if we're thinking about when we're working with young people, some very straightforward things that we can do to try and improve that sleep that we're getting across the week. So I'm going to be drawing really on the psychological techniques here today, and these come from a program known as Cognitive Behaviour Therapy for Insomnia, or CBTI, which is a really well evidenced treatment for those insomnia type problems, so difficulties getting to sleep or getting enough sleep. And these are really well evidenced techniques and treatments. So in the box on the slide here is an outline of what a CBTI program would include. And I'm not going to talk through all of this today, but I'm going to cherry pick, I suppose, some of those really kind of straightforward practical things that might be helpful for you in your own work. But this is really the overview. So as part of a program, we would be doing some education like we have today. So talking through sleep habits and sleep patterns and the relationship with mental health. We'd also be getting young people to complete diaries of their sleep so that we have a really good idea of what their sleep looks like. Then those more active components are both cognitive and behavioural. So we might do a bit of thought challenging. So are there concerns and worries about sleep, and how do we work with those? And then behavioural, we see three kind of areas of behavioural techniques. The first is what we call sleep hygiene. And this is all about what we can do to create good routines throughout the day and the evening to make us ready for bed. The second one is what we call stimulus control. And this is actually about creating a good relationship between the body and the bedroom, so that when we get into bed, when we go to bed, our body knows it's time to sleep. And this is a really kind of key area that we often stumble across when we're working with young people. Then finally, the final component is all about sleep restructuring. So actually moving the sleep pattern around to make sure that we get the optimum sleep. So for the rest of the talk, I'm going to talk you through some of the basics of those behavioural techniques in particular, the things that we can be doing to improve our sleep. So starting with sleep hygiene. You probably know most of these, or you've come across most of these before. So some of these are nice and obvious. So having less caffeine, particularly kind of heading into the afternoon and the evening, is a really kind of obvious one that most of us know. There are some that are perhaps a bit less obvious. So being active and getting exercise during the day is really helpful. That helps with that sleep pressure that we spoke about earlier, helps to build up the pressure. And similarly, getting natural light during the day is also really important. This helps with our circadian rhythm. So it's feeding messages into our rhythm about the time of day that we're in. So if we know it's if we know it's daytime and it's very light outside, our body can prepare for it to be nighttime when it's darker. So those are kind of the more daytime things. Then as we get into the evening, we want to have a nice kind of comfortable bedroom setup that we enjoy being in. Having it kind of dark and cool can help as well. Then a big one that we come across a lot with teenagers is electronics. And I know you've had a session on screen time already, so there's a nice overlap here. So we often have a bit of negotiation on our hands when we're dealing with electronics at night for teenagers. And the rule of thumb really is that we want to be coming off those in the hour before bed so that our body is unwinding. Now, there is some interesting evidence around electronics, and at the moment what we seem to know about sleep is that it's the level of activity and engagement that we are experiencing on our device that's the problem. So the more stimulating the electronic is, so whether that's that we're gaming or whether we're on social media, that's going to be much more disruptive to us than the activities that are lighter. So perhaps watching telly or reading on a phone or a Kindle, unless we're watching things that are extremely stimulating, of course. But so there can be a little bit of negotiation around which devices are really good to try and come off before bed. And it's all about that level of activity. Then the rest are a bit more of personal preference. So some people might find it helpful to have kind of diaries of what they've achieved so far or what they have to do tomorrow. And that can help with getting those worries out of the head before bedtime. And then lots of different relaxing activities. So everyone's a bit different. People might like putting their pajamas on, dimming the lights, having a bath, having a shower. lots of different things. And with teenagers, we're often looking for the things that they enjoy doing. So what do they like to do at night, and how can we support them to fit those in? So another opportunity for a poll here, and I'd like to know this time whether you think that napping can help with sleep problems.
I just had a couple of people saying they couldn't see the poll. I'm not sure why, perhaps you're on your mobile or something like that, but we're certainly getting a lot of responses here. So we'll just keep this up for a couple more seconds.
Okay, so really mixed here, which is great actually, because it's not necessarily a straightforward answer. So some people thinking it can help, less people thinking it doesn't help, and then a lot of maybes. So if we think back to the ways in which we sleep, so our two processes. If we think about, in particular, our sleep pressure, and if I'd like to kind of, I haven't got a pointer that I can use, I don't think, on here, but if you follow that kind of blue line on the first part of the chart, so imagine that we're hitting kind of 4 p.m. and we're having a nap at that point. What happens is that the pressure for our sleep drops as quickly as it does, you see, where we're, if we were going to bed at 11 p.m. So when we nap, what happens is the pressure drops all the way down. And what this means is that it can be harder for us to fall asleep when we get to bedtime, because our pressure will have only had a chance to have built back up a little bit, ready for bedtime. So what I generally say about napping is it's definitely fine to nap if you're a person who doesn't have problems sleeping. Sometimes naps can be really helpful if we're struggling and we just need a little bit of extra energy to get us through. Everyone's different, but there's definitely no problems with napping if you're a good sleeper and it doesn't affect you when you get to bedtime. But if we're working with insomnia, or someone who finds it a little bit harder to get to sleep at night, and this can be particularly important for teenagers who might be really struggling to get to sleep until later, napping can sometimes just make it that little bit harder for our body to get to sleep because of that challenge with sleep pressure. So there's not an obvious right or wrong here. It's going to depend on the individual, but that's the main message, is if there's sleep problems, we want to cut out those naps as best we can, or at least definitely not have them later in the day. Okay, so the next behavioural technique then that I said I would talk about is this idea of stimulus control. And this is all about creating an association. So our brain works off lots of different associations, and sleep is another really good example. So if we, let's think, for example, if we sleep really regularly on the sofa, then when we get onto the sofa, our body's going to think, oh, this is where I go to sleep. And we might nap more quickly when we're on the sofa, for example. So our brain creates these associations between sleep and whatever else is going on around it. Similarly, it creates associations between the environment and being awake. So for teenagers, the challenge comes in here with if we're doing other things in the bedroom that are not linked to sleeping. And obvious ones here might be watching telly, gaming, socialising, so hanging out with friends, doing homework. So all of these things, the brain is learning that this is a place where we do these activities. Now, it's hard for teenagers because the bedroom is a really sacred place and they obviously need that sacred place. So it might be more that it's negotiating what happens on the bed rather than just the bedroom. So we might be trying to encourage, doing homework at a desk if they, young people don't want to do it in a different room. And ideally watching TV in the living room rather than in the bedroom. So this is one where we often have to have a lot of negotiation, and it can be really hard for teenagers to do some of these activities in different rooms, and for young people, as younger than teenagers as well. So thinking about children who are kind of getting into the homework habits as well, thinking about where we do those activities is really important and really helpful. And that's an area that I think, again, as professionals working in schools, thinking about where those activities are done can be really supportive for helping sleep as well as education. So the final technique then is all about our sleep schedule. So when do we go to sleep? And the most important message here to take away is about routine and regularity. So we want to be going to bed at the same time each night. And if we're working with young people who have sleep difficulties, this unfortunately includes the weekend as well. So we would be encouraging children and young people to get up not too late on the weekend, as well as kind of going to bed at regular bedtimes. And this all comes back to, again, those routines and those associations that our brain has. So if our circadian rhythm knows what time we're going to go to bed and what time we're going to wake up, it will release the hormones at those times. Once we start going to bed at very different times, this is when the body gets quite confused. And what can happen, particularly with kind of the school weekend pattern, is that we try and get more sleep at the weekend to catch up, but then it can make it really hard on a Monday morning to get back into then the kind of the school rhythm, because we've had lie-ins and our body clock has started to adjust. So we want to try and keep as regular a routine as we can across the weekdays and the weekends. Again, important to note here that I'm very much talking about children and adolescents who have got sleep problems. If young people are sleeping fine and they're having lie-ins and it doesn't affect them in the week, that's really not a problem, and that's going to be up to kind of the families to work out, how that fits in with their own routines. But this is really about, when we're seeing sleep disturbances. So, as I've got here on the slide, the recommended advice is that you can have a lie-in at the weekend compared to your school day, but it shouldn't be too long. You don't want to throw the body off too much. And the final key point here to highlight is that we actually don't want to go to bed too early as well. So if we go to bed before our body is ready, all that we're going to do is lie there awake. And again, this will create that problem with an association between bed and being awake, and being perhaps a bit stressed and annoyed about being awake as well. So although sometimes we might think, it's good to get an early night, it might be, but if we're struggling to get to sleep, actually it can be quite counterproductive. So that's everything I had to cover. I just wanted to end really by sharing some really fantastic resources that might be of interest to you. Depending on what you're interested in. There's a fantastic book by Alice Gregory, which is a kind of a general public science of sleep book called Nodding Off, and this looks at sleep across the whole lifespan, so from babies and infants all the way up to older adults, and it does a really nice job of explaining a lot of those concepts that I've talked about today, but in more detail. It's a really accessible book. Then if you're thinking a little bit more about sleep interventions and support for sleep, there's a great guide for parents called Helping Your Child with Sleep Problems, written by Rachel Hiller and Michael Gradisar. So this is directed at parents. It's a self-help guide, and it very much draws on those CBTI principles that we've spoken about today. Again, it's really accessible. So I think, it might be that you're recommending this to parents, or even if you're just interested yourself, it covers some really great techniques and tips in more detail than I've been able to cover for you today. And then finally, a couple of great organisations that offer sleep guidance and sleep tips on their websites. So the Sleep Foundation and also the Sleep Charity. So other than that, really just to say a massive thank you for joining me today. It's been a real pleasure to talk to you. I've seen there's been quite a lot of tips and questions and ideas coming into the chat, which I'm afraid I haven't been able to keep up with, but hopefully Barry and our other panelists are going to support me with working through your questions.
Indeed we are. Thank you so much, Faith. Some comments from me to just open up the questions now. Firstly, I just want to say there was a great warmth in the way that you've delivered that. It was really very enveloping, and you gave such clarity to, at times, quite complex issues, and the explanations you gave were just wonderful, but always substantiated by the evidence. And I think you've already given us ideas on how that evidence could be translated. One of the tasks we hope to do further down, once we finish the trial of these 4 themes around the Ask the Expert, is to marry each session with a pedagogy in practice webinar about how do we teach. And you've already given us some ideas, I think, how we might tackle that. For myself, I was particularly pleased with the links you made between sleep and mental health, and particularly the work from the ALSPAC study, and that quite simply, the less sleep, the more risk you are at having mental health problems. And so that, if you like, is an imperative for us as teachers in terms of the conversations we have with children and young people in any age group in school, just telling them sleep is about their well-being. There's some fantastic input there, and we're very grateful, Faith. Let me start to pick up then on some of the questions. When we did the pre-briefing, you prepared yourself for the first one that's going to come out, which is about, where does the research sit on melatonin, but also on blue light? You want to hit those first?
Yeah, absolutely. So yeah, great questions. And I mean, it's a tricky area really, where I think the research is still very underdeveloped, and we still don't know as much as we would like to know. So I gave a very brief nod to kind of the technology stuff in the presentation there, but actually, I suppose the underlying message, which I didn't really flag, was that it seems to be the level of activity that is more of an issue than the blue light itself. So we do know that blue light matters. We know it influences our sleep and our hormones. So it's not to say that it's not relevant. But when we look at young people who are on devices at night, where studies have varied the level of the blue light and compared that to the level of the activity or the stimulation, it's the latter that makes the difference rather than the blue light. So what that kind of means in practice is, if young people are on devices that have a blue light, but the device is actually doing something not very stimulating and it's very kind of light touch and relaxing, if they're just reading perhaps or watching a TV program, they're probably going to be okay. The problem comes in when they're doing something very stimulating, even if they have the blue light functions turned down or reduced, like a lot of the devices do these days. So I think that's where we're at the moment. It's not to say that the research might not chuck more at us, as we move forward. But at the moment, we're very much focused on the level of stimulation from the device more so than the blue light. So I think hopefully that addresses the one side of that, Barry. In terms of melatonin, this is again another very interesting area, and is extremely variable depending on which country you live in, and which kind of academic or professional that you're talking to. So people have quite strong views on melatonin use. I think, in the UK, we certainly don't use it very often. It obviously can be prescribed in certain circumstances, but it's not readily available or kind of easily accessible unless you're being prescribed it by a professional. But other countries, America, it can be a lot easier to get your hands on melatonin. I think, I suppose my personal position is that where we can improve sleep without using kind of those additional medications, I think that's going to be better in the long run, because what we're doing is changing the habits that will facilitate the melatonin to be released at the right times naturally rather than through stimulation. But there will be situations where, it might be useful in the short term. So I think it's definitely not a write-off. But I suppose if we think about what melatonin does, melatonin triggers the falling asleep. It doesn't fix anything else. So it's going to be a kind of a relatively narrow window that the melatonin is going to be able to support. So it's important that we are, of course, looking at the other aspects of sleep habits as well, so that we're supporting the whole of the sleep cycle and not just that falling asleep bit.
Thank you. Again, that's very clear, Faith. There are some questions coming up specifically around autism, and we know that many children with autism do present with sleep issues. So there's that, and then specifically within that, Sarah Jane Critchley has asked the CBTI that you talked about. Is there any evidence that that works for children with autism? Because often CBT itself isn't the most successful interventions with children with autism.
Yeah, so great questions, and I must be slightly cautious in saying that it's not my area of expertise, so I don't want to kind of make any promises as to being an expert in this area. But yeah, I can certainly give some kind of, directions or kind of guidance on what I am familiar with. So yeah, I mean, I think, we obviously know that children with autism, and we see some similar challenges with ADHD as well. That we know, some of these children with neurodevelopmental needs or difficulties really struggle with sleep. It's such a massively common problem, and it's likely that a lot of those children are probably being supported with other interventions, and they might be medicated interventions as well in those circumstances. But the behavioural techniques are absolutely applicable to everyone, really. I think the challenge always with any type of CBT is making sure that you're adapting it in a way that works for the young person that you're working with. And I think that applies to CBTI as much as it does to broader CBT programs. So we need to be, working with the young person to think about which of the sleep techniques are going to be most useful and how do we implement them. So I think what's actually very nice about CBTI specifically is that you can really cherry pick the bits that you want to try. It's great to try all of them, but actually you can do it gradually. You can start with trying one little thing. It might be a sleep hygiene change, or you can think about kind of timings of bed. There are it can be very personalized. You can really think about what that particular child is struggling with and using the specific techniques that fit with that problem. I think the challenge often comes with autism, for example, around routines at bedtime. So what is the routine that child is currently in? Does it support a good night's sleep or does it not? And where are areas that you might be able to quite gradually introduce some changes? They're not going to be things that you can probably just chuck a whole new load of things at all at once. So very much, these techniques are definitely suitable. But I think it's about working with the families and the other professionals involved to make sure that it's being managed in the right way.
Yes, thank you. And I'm glad you threw in yourself there, ADHD, because certainly the ADHD Foundation in their diagnostic work around ADHD certainly use sleep as one of the criteria diagnosis, and therefore those children that we know have erratic brain rhythms, for example, disturbed synaptic activity, whatever, that's going to be as relevant to sleep as it is to waking activity. And I would recommend to people to have a look at the work of the ADHD Foundation. Very easy to find their website. There's a lovely question that's come through that is unusual, and I'd like to put it to you. It's around, please, someone has a child with eczema for whom sleep is a problem. Any thoughts or knowledge?
Interesting question. Not one I've had before. I guess I assume that the challenge is around kind of the discomfort, but it could be wrong. There might be other challenges that are likely to be triggered. I don't have any kind of obvious suggestions to that, really. I think, again, if it is about comfort, I would be thinking through what, I suppose, clothing, what bedding is being used. Is there anything that kind of helps to calm symptoms that you can just do before bed so that you're not going to bed kind of really kind of, frustrated and uncomfortable? But I don't know. If there's kind of any more specifics than that, it would be interesting. It's not something I'd thought of before.
And I suppose your general point about the bedroom being cool would be very relevant to the child with eczema.
Yeah, absolutely. I think there's probably going to be a few things in here that, with this example in particular, with eczema, that are going to be particularly relevant. So and I haven't really mentioned things like bedding, but actually bedding is probably going to be an important one. Is it light? Is it airy? Is the material kind of comfortable? Or, if the child's wearing pajamas or not, or kind of short pajamas, what's kind of irritating the skin during the night? Can they have, very light kind of sheets on top where possible? But absolutely. I think there's going to be, you're right, perhaps some of that more physical stuff that's going to be particularly important. But I think probably on the whole, sleep is always going to be harder for somebody who has, kind of any kind of additional needs that make life uncomfortable is probably the best word that I can use here. So I think although there might be bed specific things that could help in that case, actually the rest of the techniques as well are going to be really helpful, because whatever you can do to make yourself as relaxed and calm and kind of switch off from the rest of the challenges that you might have faced in the day, it's going to make it easier to deal with what might be a difficult bedtime experience. So I think the rest of it will still apply as well. All of these things add together. It's a very additive effect, that the more of these things you're able to do, the better your body is going to be kind of ready for sleep and for experiencing sleep.
Thank you for even exploring that and debating it with us. Let's turn our attention now to the pandemic. There is emerging evidence, I think for adults as well as for children, but let's stick with the children, about sleep disruption during the pandemic. We know, and if we look again factually at some of the points you said about getting natural light during the day, if we're restricted in going out, we haven't had access, much like children have not. Children haven't had access to their normal rhythms, which would probably be quite high energy and therefore have been more house-based. So certainly an American study that's talking about those sleep issues and tantrums then, and I think that interfaces with what you were saying about sleep and mental health issues, which are going to present in a variety of ways. So would you like to give us your thoughts around sleep and the pandemic, please?
Yeah, I mean, I completely agree with everything you've said, Barry. I think, we are getting really strong emerging evidence coming out, as we're now a couple of years in, to, what the effect of this looks like. And the evidence certainly supports that sleep has got worse, which just isn't surprising, I think, for all the reasons, like you say, that we've discussed so far, this afternoon. There is a really interesting piece of evidence that I would like to share, which is specifically about teenagers, actually. Just thinking about some of those things I said about our natural biological rhythms and the fact that our bodies want to sleep at different times. And the evidence that's come out from quite large samples has found that the teenagers, during particularly lockdown, when we weren't going to school, they've let their bodies shift to the natural cycles. So they've gone to bed later and woken up later, which for a lot of us kind of sleep experts, when the pandemic started, we thought, actually, are we going to see something quite interesting here where teenagers are letting their bodies do the natural thing? And does that mean actually they're going to be better? Sadly, no, that wasn't the case, because although their rhythms shifted to that natural biological setup, the quality was messed up because everything else about our day was not very good. So we still saw, like, all the things you were just saying, Barry, that we're not doing the things during the day that help us to sleep at night. And physical activity, light, like you said, are huge things where we're at one point we're only allowed out for an hour a day or whatever it was. I mean, think about the masses of impact that would be on your body's rhythm. And I think a lot of people anecdotally spoke to me about needing much less sleep because they just weren't doing the usual things. The body didn't need the same amount of rest as it did before. But the problem is that we know we need certain amounts of sleep to be able to function. So there's so many, I think, challenges and interacting factors with this very unusual situation we found ourselves in, and I think you're right. I think there's a big concern, and for me, I'm particularly concerned about what we see in the next 5 years, I suppose, of young people who have had real problems with sleep and have not only seen an immediate impact on their well-being potentially from that as well as other factors as well. But, you know, if those sleep problems continue and don't get better because they got, you know, bad during the pandemic, do we actually see problems triggering later in life? Thinking about that evidence that suggests there might be a longitudinal relationship, it's concerning. And I guess, you know, for me and a lot of my colleagues, you know, we're really kind of flying the flag to make sure that teenagers get, well, teenagers and children, because I mean, I've spoken about teenagers, but this is definitely not unique to them here. For all young people, making sure that they get the support they need with their sleep.
Yes, I think you're right there about with your time span about the 5 years, because there's clear evidence from other natural disasters. If we take the New Zealand earthquake situation, for those very young children who didn't have the cognitive ability or the linguistic skills to express and identify what was happening to them, it was certainly that 3 to 5 year period before some of the adverse behavior patterns showed. And again, sleep was a dynamic within that, so we need to be vigilant for a while. You're absolutely right. There's an interesting wee question here, Faith, about is there any evidence for tidy bedrooms aiding sleep?
I like that question.
Yeah.
I don't know if there's any evidence. It's possible that there is, but not that I'm aware of. But I think in those situations, it's going to come down to the individual. So, you know, some people like their messy bedrooms and they might find kind of comfort in having all their stuff out. But so it's going to be about the person. So I think certainly I do not like messy bedrooms, and it would probably be quite stressful for me if I felt like everything was, you know, not where it should be. So for me, it wouldn't help. I think it would be hard, you know, if things didn't feel like they'd been tidied away. But lots of people, you know, are much more comfortable, and teenagers are often naughty for this one, perhaps. You know, that, you know, young people don't always live in the tiniest of bedrooms. But I think it will still come down to the bedroom environment. You know, what we find relaxing as an individual is going to be the thing that matters most to us. If we like having perhaps all of our cuddly toys out in the bedroom because that makes us feel calm when we go to bed, then that's fine, as long as that's what works. Sorry, that probably doesn't help the parents out there that want to fight for tidy bedrooms.
Well, it could be a research suggestion for a future piece.
Absolutely.
You focused quite a lot on teenagers, and that's been very helpful. There's a question about when the clocks go back, how long does it take for a teenager's circadian rhythm to change? Are there things that we could do to help that transition?
Good question. I mean, I think it's not a massive problem when we're dealing with an hour shift. So I think, you know, we'd probably see the body adjusting within a week or a couple of weeks biologically. I mean, on the surface, you might not see much happening. But sorry, did I understand your question correctly, Barry? Is that what it was about the clock change? Yeah. Suddenly questioned myself whether I was going off on a tangent. So yeah, I don't think we have massive concern here, but I think if young people do struggle with that shift, what I would be saying is it's about consistency. So it's actually, you should really think about sleep change as being like jet lag. It's really, and I kind of, it's not a silly suggestion. Actually, the effects are almost identical. So when you change your sleep, what you need to do is be really hard on yourself, you know, like, you know, back in the days when we used to travel, you know, when you would come back and you'd have to go, right, you know, I have to get up even if I don't want to get up because I know my body needs it. And it's the same kind of thing. So I think as soon as we go through any kind of time shift, we need to push our bodies back into that rhythm as quickly as possible and treat it like the new time that it is. That's the best thing that we can do, rather than thinking, oh, I'm going to have a slightly longer lie-in because, you know, I know the clocks have changed. It's all about getting quickly into that habit. I just wanted to add, Barry, as well, I think just on your point about kind of, you know, teenagers and the focus on teenagers, I think one of the reasons I do that is that we see those real challenges when we hit the teenage years, but all of the kind of the content and the techniques apply to both. So the kind of the the techniques and the treatments and the relationships between sleep and well-being are consistent across the ages. So it doesn't, it's very much the same whether you're talking about children or teenagers. But we just see those slight unusual different challenges when we hit the teenage years that are just important to be aware of. And it might for some children happen younger depending on puberty, so you might see this happening at younger ages as well.
And I think actually you're right to have given that additional bit of emphasis to teenage years, because we know, again, factually from the research evidence, that is the age phase where lots of mental health issues start to display themselves. And if there is that strong link, as you said from the Alphabet study, between sleep and mental health, then we need to be vigilant. But actually, it just underscores, doesn't it, how we do need to teach about sleep. And those sleep hygiene routines you very helpfully laid out. It's about the teenagers' self-regulation there, about knowing that they are going through a vulnerable phase, that their brain is going through its second most rapid growth period since the first year of life. And therefore, there's a lot of disturbance, natural disturbance. I don't mean unhelpful disturbance, but there is disturbance. The brain is growing and is very plastic. And therefore, a bit like with the teenager that's gangly and uncoordinated, the brain goes through uncoordinated phases in all of its dimensions. And I guess that would impact on sleep. But it's about knowing yourself, isn't it? And I think, therefore, the stronger we can get as teachers in teaching sleep, the better. And I just want to emphasize again to participants that one of our intentions is that we'll be developing a pedagogical piece, how to teach, to go alongside what you've said today, Faith. And actually there's some excellent questions coming through, excellent ideas. And so the question we talked about, Faith, about eczema, an eczema sufferer has actually said cool bedrooms, routine, the creams, etc. And so also some sleep medications and short nails, because you don't consciously scratch during the night. So yeah, I mean, just some lovely ideas. And again, we talked about autism. And weighted blankets has come up, and Sarah Jane Critchley, who used to work for the Autism Education Trust and is now an independent consultant, she's quoted some research from Georgia. I'm not going to be able to say the Greek surname here, but I'm ducking that one. But she's given the link to a very helpful piece for people to look at around some of the outcomes of and the impact of sleep for children and young people with autism. So this cross-fertilization of ideas and sharing of information is proving very, very useful here.
Yeah, absolutely. I mean, and I think I so often find this when I do, kind of events or activities similar to this, where there's so much to learn from people out there. I think this is the thing, all of us have to do this every single night. And, we all have experiences of things that have been helpful and unhelpful. And I think there's so much to learn from those personal experiences of those kind of tips and tricks. So yeah, thank you so much to the individuals for sharing those points.
We'll be capturing all of that and using it in our future work. So thanks to everybody. There's a question about where does research stand on controlled crying with infants? I wonder if this is a teacher mother. Linked with parental mental health. What are the long-term developmental mental health effects on the infant?
Ooh, that's a tough question. The literature on very early infant sleep and long-term mental health is actually very, very limited. So we know very little about various aspects of infant sleep and the kind of significant long-term effects of that. There has started to emerge some kind of, initial studies, longitudinal studies that have tried to do that type of thing, but they're really early days. We'd need to replicate the findings and, do it with a range of methods. So we don't know much. I mean, definitely not specifically about kind of the controlled crying and the long-term mental health. But in terms of sleep kind of therapies, so there is a lot of sleep clinics and sleep experts that obviously work with very, very young children. And my understanding, although I don't work with infants, my understanding is that it can be used as a technique if you are really struggling with routines with children, but it's done in a very gradual way. So, it is very much a case of, leaving the child for a tiny little bit longer each time. It's done to the point so that the child isn't then very confused about why they've then been abandoned. That it is this kind of graduated approach. But yeah, I've certainly got colleagues that work with infants that I know use it as part of their programs, but I think it is done in a very careful way. And I've got colleagues who would sit on the other fence of child development who would be anti the approach. So I think quite often when you're dealing with challenges like this, and it's about the families, it's about what is difficult for you at that point in time. If the sleep routines are causing massive disruption to your life, then you're probably going to need some help with working out how you're going to improve those sleep routines. Whereas if you can tolerate it and you're kind of happy to look after the child, and you can manage, then it's really going to be about the family as much as it is about the infant. I think one other thing I would add here is and you kind of, it sort of touched on something you were saying earlier, Barry, is about that self-regulation. So I'm particularly interested in doing some work around, that kind of the regulation of infant sleep, and how quickly that skill to regulate your sleep actually might become important in the skill to regulate many things, including emotion. So I haven't done it, unfortunately, yet, and it's one of those studies that takes a lot of time and money, but I'd be really interested in knowing a little bit more about kind of the development of our regulation. Sorry, that's kind of a fumbled answer because I don't know the specifics, but
well, you actually have expertise in this. For us as teachers, this is an area where, yes, we all sleep as human beings, we all sleep, but it's an area where we're trying to build up our skill base, so it's worth probing the thinking around this. Can I just encourage delegates now to actually look at the survey link before we finish tonight's session? The survey is really, really important to us at the moment. Myself and Joan Gray, who is very instrumental in preparing for this evening, have to present a board paper on the 10th of December as to the ACAM board as to why we should carry on these webinars and expand them. And so your feedback genuinely is crucial to us at this point. So can I ask you to look at the link? The survey link has just gone again into the chat. Can you click on that, and while we make some concluding comments, please would you fill that in? We really would be very grateful, and your views are going to be able to go forward to that paper on the 10th of December. I want to again thank Faith for her magnificent contribution this evening. The way that you've just dealt with these issues, Faith, has just been not only wonderfully professional but deeply human as well, and thank you for all of that. You mentioned consultants in your last response to a question, and I've been interested in talking to people about this evening because it's a new topic for us as teachers. One head teacher saying actually when she does parental interviews for admission to her primary school, one of the questions she asks about is, how does your child sleep? So that, I just thought that was good practice. I know a group of schools in Surrey, special schools, that have actually employed sleep consultants because they saw, so many parents are reporting irregular sleep patterns in their children, and obviously if the child is not sleeping well and is tired, they're not going to be the most efficient and effective learner during a school day. So that as well. So there are pockets of practice emerging, I think, that we should capture and hopefully capture more. And certainly if schools do have programs or particular approaches they're using, we would be pleased to hear about them, because when we do the pedagogical piece, we want to be able to capture interesting practice and what is developing practice. It's got to develop. We have little or no basis as teachers. We have a basis as human beings who happen to be teachers. But in terms of our teaching repertoire, it's not as extensive as it would be in teaching phonics. Don't all faint on the spot. I've mentioned phonics. So again, just a great thank you. Thank you to everybody for their contributions this evening. Can I just recommend to everybody you have a quick glance at the chat room, because people are recommending links, and there's some really thought-provoking comments in there from Maria Boyle, Rachel Titchband, Esther Richmond, Nancy Hughes. Some really interesting, thought-provoking comments. And whilst we've not addressed them directly this evening, folks, there will be other opportunities to come back to this topic. There is an opportunity for us to grow our knowledge base as a teaching profession. We're grateful for your contributions this evening, but we would like your ongoing contributions as well. There's an untitled poll just come up. Would you recommend this session this evening, no pressure on Faith here then, to other people? Could you fill in that poll before we log off this evening? Can I remind you that the next one of these Ask the Expert sessions is the 27th of January. We have a wonderful speaker on anxiety, Professor Cathy Creswell from the University of Oxford, and it promises to be a really wonderful session. Cathy has a colleague she's bringing along who was a primary teacher before beginning her current research at Oxford University. So I'm sure there's going to be some very relevant stuff that evening. So again, one final thank you from me, and farewell to all of you. Thank you very much indeed. Thank you.
Find out more about becoming an ACAM member and to be part of the advancement of child and adolescent mental health, visit www.acamh.org.